Struggling with infertility can be physically and emotionally exhausting. Fortunately, laparoscopy is a key. Sometimes that can't be found on simple investigations like ultrasound and HSG. We can find it on laparoscopy. So laparoscopy, we say it is just not a diagnostic procedure. We do it as a diagnostic as well as in the same sitting, we can treat that particular disease the patient is suffering from. For diagnostic purpose, we see the uterus, we see the tubes, ovaries, as well as is there any pelvic adhesions or not, and also whether the utero-ovarian axis, utero-tubo-ovarian axis is correct or not. And what is this laparoscopy? So laparoscopy is just small pen-sized camera as well as instruments are there with which 3 to 4 incisions we can see what the problem is and at the same time we can treat the problem. So what are the various diseases or issues that can be solved with laparoscopy? Number 1 is endometriosis. Endometriosis, it is the main reason for the infertility. If on ultrasound or on MRI, there is an endometriotic cyst that can be removed, and in the same sitting adhesions can be removed and uterus, tubes and ovarian axis can be maintained. Next is if there is any other type of cyst is there that is diagnosed on ultrasound, that can also be removed. And if there is a PCOD, that is refractory PCOD, that means on giving medicines there is no egg formation, or there is even on IVF there is no egg formation, then usually we can do ovarian drilling with the help of laparoscopy. Then another is if on HSG, if on tubal test the tubes are closed, that can be at the level of the uterus or at the end of the tubes. Both of these can be diagnosed as well as treated with the help of laparoscopy. Add hysteroscopy with it, we can treat any problem like fibroid inside the uterus, or there are some adhesion inside the uterus. We can remove that adhesions, we can remove that fibroid in the same sitting. In the end, I'll say laparoscopy is just not a diagnostic tool. It is a turning point in your fertility solution, that it will help us to see clearly the things you are suffering from, and we can treat it precisely and you will come closer to your parenthood. So if you are suffering from fertility issues and are going nowhere, so please discuss this option of laparoscopy as well as hysteroscopy with your gynecologist. Thank you.